Hello everyone, I'm Dr. Apoorva Ayachit, a vitreoretinal surgeon from Joshi Eye Institute. I'm going to speak to you about endogenous endophthalmitis, and I thank YOSI for giving me this opportunity. Endogenous endophthalmitis is usually due to a hematogenous spread of infective organisms from a distant systemic focus of infection. It is much less common than postoperative endophthalmitis, comprising only 5 to 7% of the total number of endophthalmitis cases. Risk factors include the most common being diabetes mellitus and history of recent hospitalization, immunosuppression, malignancy, and everything else follows much later. The usual focus of infection is a liver abscess followed by pneumonia, UTI, and endocarditis. The causative organisms include fungal, which comprises most of it, that is 50 to 60%, of which Candida is the most common. Bacterial include gram-positive, that is staph and strep, and gram-negative includes Klebsiella. Let's look at some case scenarios. This is a 3-year-old boy who came with diminished vision for 5 days associated with redness. There was a history of fever 20 days back and also 5 months back, which were both treated with IV fluids given as only supportive treatment. There was no history of typhoid, rickettsia, or any vector-borne diseases, and no history of antibiotic usage. Vitreous biopsy revealed DNA of Candida on PCR, and he was treated with amphotericin intravenous and systemic oral fluconazole. The presumed cause of this infection, Candida endogenous endoph, was contaminated IV fluid used for supportive treatment for fever. And in India, it is pretty common because these IV fluids are given in less than ideal aseptic precautions. Now, this case, I thank Dr. Mohit for giving me this case and also Dr. Simar. So, this patient, a 40-year-old man, came with diminished vision in both eyes for 5 days. He is a known case of hepatitis C with chronic liver disease for 2 years. He was admitted in view of the same for 1 week, 6 months prior to the presentation. And there was a history of UTI for 10 days now, and there was no history of diabetes. Look at this case. It looks so different from what we saw earlier in the sense that it has a subretinal, almost abscess-like finding or a subretinal hyperreflective material. And both eyes had this yellowish lesion, which was diagnosed as subretinal bleed elsewhere and as a case of polypoidal choroidal vasculopathy. Now, this patient, since his systemic condition was such, was admitted and with a high degree of suspicion for endogenous endophthalmitis, was given intravenous antibiotics and topical treatment. And this was piperacillin and tazobactam, and the vitreous tap revealed gram-negative bacilli. This was diagnosed as both eyes endogenous endophthalmitis associated with chronic liver disease. And see this progression with IV treatment and intravitreal treatment over follow-ups. He got better eventually. So this is a 10-year experience in an endemic region which showed that Klebsiella endophthalmitis was very common and is associated with a high incidence of liver abscess and diabetes. So the primary management of endogenous endoph is, of course, the eradication of source. So a sending of a blood culture, urine culture, and stool samples for sensitivity and finding the causative organism. PCR should also be considered, which will reveal some pan-bacterial, pan-fungal genome as a screening and specific bacterial and fungal markers on PCR. Systemic broad-spectrum antibiotics and antifungals are necessary. Intravitreal specific antibiotics are also to be used, and adjunctive therapy is, of course, always used with topical medication and anti-glaucoma as indicated. Here are the doses of the antibiotics, which you can take a screenshot and use for your reference. So the further management includes, of course, if it is persistent inflammation, there are vitreous infiltrates. You see that there is retinitis, retinal necrosis causing a detachment. Then also, importantly, to necessitate a vitreous biopsy, a pars plana vitrectomy is indicated. Here are my references, and I encourage you to read the same. Thank you so much.